Bob and Brad, the two most famous physical therapists on the internet.
Howdy, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
And
therapist.
together we're the most famous physical therapists on the internet.
In our opinion, of course,
I don't know
Bob.
why I always look at you when I say that, but
I don't know anybody would look at me when they say anything.
all right, I'm gonna tell you a little bit of a story about a flexor, somebody who has back pain that is a flexor.
A flexor?
Yeah, well, we did a
Oh, like a
previous.
flexor.
Yeah, we did a previous video where we
Oh, yeah.
tried to tell you whether or not you were a flexor, extender, which Brad is,
Yeah.
compressor, or shaker. But today we're going to talk about just the flexor. And
So, in other words, those are people who, when they bend forward or they sit rounded, it increases or dramatically increases back pain or even possibly leg pain. Sciatica.
yeah, let me give you an example of somebody like this.
Okay.
Okay, let's say you sit on a couch that's really cushiony,
Mm-hmm.
and you sit there for hours watching TV. Then your spouse comes along and says, "Hey, you were supposed to cut the lawn."
Yeah.
So you go out and Brad goes out. Now somebody goes out and cuts the lawn, and you're on the riding lawnmower.
Yeah.
And what are you when you're on the riding lawnmower?
Yeah, and you're bouncing.
Yep, you're
if your lawn-
bouncing.
if your lawn's like mine.
Yep, and you're flexed. You might be in a rounded out position. So again, you're flexed. Then finally, you remember that you left a cooler inside the trunk of your car. So you go in and you reach inside, round out your back.
Right, because you're probably thirsty at that point.
And it's heavy, and zap, there goes your back. Because you did 3 events in a row, sitting, and lifting with the back rounded.
Right.
So that's a typical scenario with a flexor.
Right.
Now, if you think you may be a flexor, you can actually ask yourself these questions. Are you generally worse when you're sitting? Like, is the pain worse when you're sitting? And it's often better with walking or standing.
Yep.
Are you worse after prolonged bending, like vacuuming or like your bed, making the bed, which
Yep.
you I'm sure don't do. Vacuuming, I said already. Ironing, digging, or gardening.
Yep.
So-
Anything where you're bent over for a period of time.
For a prolonged time. And are you often better with lying down? So that's the questions we're going to ask. Now, you can also do a few tests. You can just actually, in a standing position, Brad,
Yes.
if you want to show that, and I'll show in a seated position, you can actually just bend forward like this, round out your back, and maybe do it like Mackenzie wants you to do it repeatedly.
Yep. After 10 times, does it start to irritate things? It gets sore. And then when you get up, is it hard to straighten
Right.
back out? And if that's the case, you're probably a flexor.
That's a big sign too, isn't it? When you've been sitting for a long time and you get up and it hurts.
Yep. And then you straighten up. And then after you're up for a little while, it gets better.
Now, a lot of people who have a disc problem or a sciatica
Mm-hmm.
are a flexor.
Right.
And we're going to show, let's see.
It's a nice model showing
Yeah.
how the disc can actually start to protrude. And here's
want-
the nerve. We're going to
Yeah,
get that out of the
and
way.
These are 2 bones that are in your back,
Mm-hmm.
your low back. Now, if I bend forward, I'm moving the 2 bones
Whoa, can you see
together like that.
Tanner, can you see that? Yeah, right there is a bulging disc. You can see the fluid or the nucleus pulposa, it's known as, comes out. And here's the nerve, happens to be right there. Do it again, Bob. And pinch, pinch, pinch. Owie, owie, owie. Get back in there. Oh, that feels better. So, in other words, the rounded position will help make that
So
bulge
these are
come
the
out.
bones we took out of this guy's back, we say.
Yeah, a little
But if
discectomy.
you bend forward like this, that's what causes that bulging or that herniation.
Yeah.
So we're going to want to avoid that position of going forward, and we may even want to go back the other way a little bit.
Right.
So, but first, let's talk about in a chair, Brad. What things do you want to avoid in a chair?
Good point, Bob. See, that's why, the old seating is the new smoking. Seated. Anyways, so
Sitting.
sitting is a new smoking. In other words, like this is particularly bad, and you stay like this for a long period of time.
And where does it happen a lot is on a recliner
Yep.
or on a couch.
Soft.
Nice, soft,
Yep.
feels good, but
And
it's
some
not doing you good.
cars, you know,
Right,
some
right.
cars, some people don't know they have the lumbar adjustment, and I've had patients do that. Well, get a lumbar support or adjust your seat, push the button, crank it up, whatever it does. Get that in there, and oh, whoa,
See,
that feels
it
good.
straightens them up.
Yeah,
Takes them from being that rounded out position to more of a straight position. Now, if you're on a couch, you're gonna have to take like a throw pillow because
Yeah.
you really got to correct it.
yeah,
But so he's like this. He puts the support in there, and it fills in that gap.
yep, and it pushes that back in that proper posture.
Right.
This is a different one. You know, this is a little bit bigger if
Yep.
you're a larger person, or if you've got a chair that really has a big dip in it. You need something larger.
Well, if you got a large butt. I mean,
You
let's
always
be,
like to
let's,
talk
let's
about the
be
butt.
honest.
That's
If you have a large butt, you're gonna have a big gap there.
Yeah, but if you got a
Yeah.
chair that goes like that, you need
Right,
to
right.
get that in there.
All right. Also, you're gonna want to avoid bending like this, like if you're making a bed.
Yeah,
What you want to do is learn to bend at the hips and keep the back straight.
yeah,
And this is a whole thing that it's difficult to teach. And,
right.
You know,
No, they talk about the hip hinging,
right.
and
right.
weightlifters practices so they don't. beat
All
up
the
their back.
movement should come from the hip.
Yes.
There's no movement coming from the back.
Right.
So
Okay.
that's the same with gardening. You want to get down on your hands and knees, maybe, and in a quadruped position, and
Or
keep the back straight.
or just go down like this to pick something up versus this.
Right.
And let the legs do the work, not the back.
Now we'll show you some exercises too. That
Ooh.
well, I'm going to show that if you want to take these out of the way,
yeah.
Brad, I'll show one thing you can also do for back pain when you're lying down. If you're a flexor, when you lie down, and if you lie on your back, you actually could be rounding out your back,
Mm-hmm.
especially again if you have a large butt. If you have a large butt, so you can actually take a rolled sheet and tie it around your waist.
Yep.
Or eventually you can buy an actual sleep roll, they call it, McKenzie, McKenzie, McKenzie sleep roll, and it can tie it around your waist. And that way it's in place when you lie on your back.
Right. Right.
So, all right, let's start with the number one exercise. Very simple, Brad,
Ooh.
if you don't mind.
Oh, I'm sorry. I'm in the way.
You're going to just try lying on your stomach. So if you were bending a lot, this is going to start correcting it. Now, if this is bothersome, you might try a pillow underneath your abdomen. But if you can tolerate, try the stomach itself. Another one is cat camel, and it's just starting to get some movement in there. But
Right.
you actually go into the flexion a little bit just to keep your things moving. All right. Next one is McGill, where he just has you lie on your stomach and actually put some fists. So you're starting to bend the other way,
Starting to
just
extend
slightly.
right here. Yep.
Right. And next one, this is a little more aggressive. We call this prone prop because you're in the prone position and you're propping on your elbows.
Yeah, and if you're a flexor and you can get to this position and it feels good, boy, you know you're right on because it's
Yeah,
And you'll say like that not for hours, but for a few minutes.
right. As long as it feels good.
Mm-hmm.
And I would guess that if you're younger, you're going to be able to do this a lot easier.
Yeah, yeah.
So next one is micro press ups. So you're not pressing all the way up, but you're just putting your hands underneath your shoulders and pressing
Yep.
and bending it a little bit. And then finally, you can go bend all the way up if you're working on it. Now, the big thing is you don't want to lift your pelvis off the bed like this. So you don't want to go like this. You just want to go as far as your back allows you to. So
Keep
if
that down.
if it does not stay down, just work in that area.
Yep. Don't go so high.
Right. So, well, that's again kind of a synopsis of what to do when you're a flexor. We'll go and we'll talk about what to do if you're a Brad extender. We'll do that next week, but or the week after. But
Yeah.
That's
I'm not the only one out there though.
no, he's one of many.
More people are flexors than extenders though.
I think as you get older, there's a lot of
Yeah,
extenders.
I would imagine so.
So.
All right. Well,
All right.
good luck and stop flexing.
All right. Thanks.